Hi, the following is my presentation on women's health experience breast cancer. I interviewed patient A, who is a 34-year-old female. She was diagnosed with invasive lobular carcinoma, also known as ILC, at the age of 31. During an annual exam, her doctor felt a lump in her breast. A mammogram, ultrasound, and biopsy were conducted to confirm the diagnosis. Treatment options for ILC are typically a lumpectomy with radiation, single mastectomy, and a bilateral mastectomy. Due to her family history, she opted for a bilateral mastectomy with reconstruction. This was roughly a 6-month process after receiving the diagnosis. She continues to receive medical monitoring. She sees a breast surgeon on an annual basis. She receives an MRI every 3 years, and she also sees her oncologist biannually. Roughly 2 years after her diagnosis of ILC, patient A tested positive for the gene mutation. There is a link between ILC and gastric cancer. Upon receiving the positive gene mutation diagnosis, patient A opted to have her stomach removed to lower her risk of having stomach cancer from 80% to 0. Her current health status is cancer-free. ILC is the second most common breast cancer in the United States. It affects all ages, although there are higher rates found in aging women. It is difficult to diagnose through imaging as the cancer spreads in branch-like patterns through the breast. Treatment is based on the size and location of the tumor, but treatment can include a lumpectomy, a mastectomy, chemotherapy, radiation, hormonal therapy, and biologic treatment therapy. There also is a link between gastric cancer and ILC, just as in patient A's case. There are studies that show that estrogen and progesterone use in pre- and postmenopausal women can have an effect on becoming diagnosed with ILC. I interviewed Elizabeth Bongiovanni, certified nurse practitioner at Leader Surgical Associates in York, PA. She stated that the average patient age is in their 50s, but they do see patients anywhere from their 30s to 90s. Majority of the patients are female, although men have come through being diagnosed and treated for breast cancer. Leader Surgical Associate provides medical care for patients with breast cancer, breast infections, and positive for gene mutation, although they have not officially been diagnosed with cancer. They conduct clinical breast exams in the office, and they also order other testing such as MRIs, ultrasounds, and biopsies to confirm diagnosis among their patients. The center works with other healthcare professionals, which are coordinated through a nurse navigator at Leader Surgical Associates. Every patient gets a nurse navigator that helps with other doctors, other counseling services that would be beneficial to the patient or the families during this time, and any other type of medical treatment that the patient needs to have. Most healthcare insurances do cover a lot of the services, but additional support can be offered and provided by the surgical associates, which is coordinated again through the nurse navigator. The office has a pantry that patients and families are allowed to access during this time in case there is some type of financial struggle due to a lot of patients are unable to work and while they're receiving treatment. Some of the challenges that Elizabeth experiences is speaking with patients and families about prognosis. It's not fun being the one to tell a family or their children that the outcome does not look good for a patient, for their family member. Some of the positives that she did share was the strength of many of the patients. She said a lot of them are very positive and they're encouraging to other patients and even the staff within the facility to just continue to live life and do the best that you can. Liz mentioned that health and wellness, overall health and wellness, is very important to every individual, whether they have been diagnosed with cancer or they have not. Good health and wellness can protect from reoccurrence of cancer and also help with the treatment of cancer to have a more positive outcome. Elizabeth did provide a wellness brochure that she provides to all of the parents, and I have attached it to my discussion board. If you have any questions, please let me know. Thank you.